Hi, I want to talk about what to do if you get a laceration or a cut that needs stitches. Unfortunately, this summer, I've had a number of people and actually a number of kids that I've had to sew up after hours because they went to the emergency room. The emergency room told them that they did not need stitches, put on steri strips and sent them home. And then the concerned parent or the concerned wife or husband sent me a picture because I'm friends with them and I couldn't leave it be and I had to stitch them up. So let's talk about this in a little bit more detail so you, the consumer, can be educated on how to protect yourself or your loved ones if you have to go to the ER. If you are bleeding from a cut or a laceration, go to the emergency room. You want to make sure nothing's broken. You want to make sure that if you have a risk of infection because it's from a dog bite or a cat bite, you get put on antibiotics. And hopefully there'll be somebody there who can do a skillful job of sewing up your wound. Now, when you get there, if they say, hey, there's no one here who feels comfortable putting in stitches, or hey, steri strips will probably be okay, second guess that. Ask if there is a plastic surgeon on call. Ask if there's a dermatologist around. Ask if there's anyone there who feels comfortable putting in stitches. In the best possible scenario, you would have stitches put in by someone who's very capable of putting in stitches, and they would put in 2 layers of stitches. That is what's going to heal the best. Oftentimes you're told, oh no, stitches aren't going to look as good. That is because if the stitches are left in too long, you can get those caterpillar hash marks. You don't want that. You have to make sure you get the stitches out in a timely manner, which is why 2 layers of stitches is so important. The top layer comes out much earlier than the bottom layer. The bottom layer your body absorbs, and that holds the wound together while the scar continues to form. So first choice, you get a top and a bottom layer of stitches by someone who knows what he or she is doing, and then you leave, and then you have a follow-up plan with your primary care doctor or with your dermatologist to take out those stitches. For the face, the stitches come out in 5 days. For the body, it's more like 2 weeks. Now, the second thing that can happen at the ER, which is a pretty good option, is having them use super glue or Dermabond. That will hold the skin together pretty effectively. If that's not available, then the third thing that they provide is steri strips. That, in my mind, is not an acceptable option. If that's the only option they make available to you, then you should ask if there's someone you can call the following day to be sewn up. And oftentimes you can get an appointment with a plastic surgeon, with a dermatologist, with a dermatologic surgeon like myself, like a Mohs surgeon, who will sew you up the next day, particularly if you've been to the ER and have been worked up and there isn't anything more significant going on. That's your best choice. Stitches by someone who knows what he or she is doing in the ER, Dermabond in the ER, or the following day going to someone who is a skilled surgeon to put in your stitches. It's also really important that you know how to take care of your stitches after you get them. Stitches should be cleaned on a daily basis, and they should be kept moist with some sort of ointment so that the skin does not does not dry out while it's healing. So for patients of mine where I do surgery on their face, I have them clean their wound every day with dilute hydrogen peroxide, and I have them cover the wound with either plain Vaseline or my Restore Healing Balm and reapply a Band-Aid or a non-stick dressing like a Telfa. That's what you should do every day on your stitches until your stitches are removed. Once your stitches are removed, then you should make sure that that scar stays out of the sun until it's entirely healed so it doesn't pigment. There is a way to get a good result when you get a bad cut, even if it's in the middle of the night, but you need to know what to look for. So you want stitches, you want 2 layers of stitches. If you can't get stitches, you want Dermabond. Steri strips might help control the bleeding and make you feel better in that moment, but you do want to find another long-term solution, and it's okay to get stitched up the next day. Okay, let me know if you have any questions. I'm here to help.